The recording and the live stream were linked, and so David was working to restore it. Had that failed, we could have just gone with recording without live streaming, but we are live again.
Okay,
Thank you.
we'll pretend like this is the first time that you've heard our introduction. We are genuinely very happy to be here with you all today. We're going to walk through some scenarios as part of the MFP planning process. We had a chance to share them with your leadership team, go through some prioritization exercises, and we'll be able to speak to that a little bit more as we get into the discussion. But you can follow along in your packets. You've had a chance, hopefully, to review some of the potential scenarios for all of the sites. And Amanda will start us off walking us through.
Okay, so this will be more of a discussion than a lecture. But I will just get started here. These are just kind of the background and key steps, considerations in this process. We've talked about how to meet demand, some of the brainstorming ideas, and what really comes through with all of the surveys, interviews, walkthroughs, and research. The main takeaways are here in the pinkish orange box that the satellite offices need behavioral health service office space, community rooms for classes and meetings and small events, and that the WIC offices really need visual and sound privacy. Sound privacy is an issue that needs to be addressed, and that the shared hub concept with community partners like the Marsing Hub has been very successful and is a model worth replicating. So our approach to looking at this process is to, number one, start with how do you improve what you have? Then consider moving elsewhere or potentially partnering at a shared hub. So the approach on each of these buildings is that way. This is we had already talked about this last time. I updated some of the times because some of the times had changed in this chart about when operational hours are. So we'll dive into the Caldwell office. And the Caldwell office it's oversized, but it's got room to grow. It has the space to accommodate more staffing as staffing increases. Currently, it is functioning fine. Although one thing that has come up is converting clinic room number 236 into an infectious disease room, which involves putting a door directly to the outside and changing the HVAC system so that the contaminated air can be exhausted outside and doesn't affect the rest of the building. Gonna move on to Payette, which is also in good shape and has room to grow into. It is a good model and size to compare for other satellite offices, although it might be a little bit large. It's got 4 exam rooms when some of the other satellite offices only have 2. It's kind of double the size, but there's room to grow into. There's a few things that do need to happen in this space, like lowering the transaction counter at the reception desk. It's not ADA accessible. And just reutilizing some vacant space within there. These are some options to deal with that and add behavioral health rooms. So the existing building is up here. I guess it is kind of hard to see on the screen. With a few changes and removing a couple walls, you could make some improvements to the space by if you remove the wall here between the file room and the parents as teachers, it could become a larger conference room, and dividing the existing conference room would give you some behavioral health or WIC space or other office space. If to add a community room to that space, it is possible to remove the walls here of this office, making a larger space here to do community room things. These are all options or scenarios, but as is, the Payette office is functioning very well. So I'm going to move on to Weiser. This one has the most challenges. The building is undersized and the layout is not very accessible. So There are some ADA issues about a parking space. They need an ADA parking space probably in the back, and I'll show you that. The reception desk is not compliant. And really the layout makes the entire space hard to function. So taking the approach of improving what you have, reconfiguring that space would help. It's still undersized, but it could function better. The big problem right now is that the circulation, to get back to the exam rooms, the patient has to be escorted through the immunization and storage room. There are some rooms that are very oversized and some that are too small. By removing some doors and one wall, and also being careful not to mess with any of the concrete block walls, because the exterior is all concrete block, and then this bearing wall here is, it is possible to shuffle some of the rooms around where the reception is right where you come in. The nurse's office moves from the back up here to the front where part of the reception was. The lab and vaccine room can move into the former file room, which enables another office, whether it's behavioral health, WIC, or exam, can be installed in the immunization area. But the way this works is there are corridors on either side that serve the front to the back of the building, and they are secured with a door. Now, this also can open up a waiting or community space up in front, which is still pretty small, but could be useful. One step, oh, and back here behind the building, paving the parking lot, adding an ADA spot. This door could have digital access for someone who is disabled to be able to come in through the back, but the main entrance would truly be up front for security reasons. Now, again, sticking with the improving what you have, it's considering purchasing the building next door. Currently, according to Google, there's a law firm there. It's a small building, about 1,300 square feet, but it could easily be converted to a community room space with proper ADA restrooms. It could be used after hours or during hours. And there's probably space to have additional office or exam rooms in there. Another thought came up with, what if, since the property is owned, what if the entire building is demolished and rebuilt? And so that's what scenario 4 on page 17 looks at. And it's how much square footage is there in a comparison to, you know, if you put a Payette size building on that site, how that is possible. Should I stop here to discuss it, or should I go through to Emmett and then we come back? What do you think, for sake of time?
Opinions, thoughts?
Yeah.
I kind of like to see the overview of everything.
Okay,
first.
okay, and then we'll head back. Okay. And so other things to consider is relocating to a new building altogether, or forming a hub in the Weiser area. So I'll jump ahead to Emmett. Now, Emmett is undersized, but it has a very functional layout. And it does have a couple ADA issues, which could be, you know, easily solved. The front ramp needs some repair. The reception desk, again, is too high, and there needs to be a new sink in the ADA restroom, which is in the back of the building, which kind of causes some problems for patients because they need to be escorted to the back to use that. It would be nice to have one up front. So if you look at some of these scenarios here, just with a few little changes, and there's a phase 1 and a phase 2, dividing this oversized reception area can opens up some space for a nurse's office on the other side, like a nurse's station that's open. It could still be the same reception desk that's there right now. Then the existing conference room could be divided in half, and then you would have behavioral health rooms. By moving the nurse's office to this open area, it opens up their current spot over here to be another exam room or behavioral health. Now, better yet would be to add a small addition to the building, which moves the ramp and the entrance, because right now it's very congested coming in through this way. This would create a community room outside with ADA restrooms up front and better circulation and eliminating congestion coming in through this spot. There is space for this addition. There's 50 feet from this from the property line to the existing building. And this addition here, this is kind of a basic 24 by 24, kind of the size of a two-car garage, along with the restrooms, but there's space for it on the existing lot. Next, I'm gonna talk briefly about the WIC services. There are several locations, most of which are shared, and there are pop-up locations where the provider goes and sets up. They have visual privacy screens, but sound continues to be an issue. It would be very helpful in the places like the Nampa office, which is leased, if it would be possible to do a tenant improvement to put hard walls, insulated hard walls, so that there is that sound privacy. That is more difficult at Farmway, Homedale, Council, and there's been a new pop-up location on occasion in New Meadows, the way I understand that. But having a way to have private conversations is critical for WIC. And there's a few, this right here is the Nampa office. You can see that there's visual privacy, but sound is an issue. They do use sound machines, but it only does so much. The other one here is Homedale. They set up in the old library. Luckily, they are the only user at the time, so there aren't other people trying to use the space, but there are often more than one family in the room at the time, and so privacy is an issue. Another thing we were looking at is what, with growth, a future office will be needed at some point. And this page kind of describes what would be necessary. Probably a building, I don't know where this would be, but future office would probably need to be about 3,000 to 5,000 square feet. Or you could establish other hub locations, or what's the other? Or, building new buildings. The last page here just describes the Marsing Hub. Again, it's been very successful. It could potentially become another WIC services location, but currently it's clinic only. That is it from the packet. We should probably jump back to talk about some of the buildings. Your thoughts, questions? Where should we start? Fast overview.
Maybe some, as we went back, some kind of high level context too, as we went through the scenarios and looked at each of the buildings, after going through all the analysis of conditions and also demand, demographic reports, all the other feedback from stakeholders, initially coming in and from a facilities perspective, what do you need now? What do you need in the future? And to some extent, largely a blank slate from our perspective. Do you need to build new buildings? Do you need to just do remodels? Do you need to completely go with an alternative delivery source through mobile? And kind of as we went through this process and narrowed things down and looked at the facilities you have, it narrowed things down to, the facilities that you have are largely good facilities. There's definitely rooms for improvement, some of it, and just walk through those. So the opportunity kind of that flush to the top in the scenario building was remodeling versus starting from scratch, taking into consideration in some of the rural areas, also considering, okay, finding a new building rather than building new, but there's limited access to available building, not the smaller locations don't have a whole lot of buildings to go by. So as you're seeing what you have in front of you, that's kind of the result of us trying to do some filtering and taking out stuff that probably just doesn't make a lot of sense to even go down. At the same time, not telling you exactly what our necessarily answer would be, because we want to get your feedback. How do we adjust this? How do we work through each of these to come up with the best long-term solution for your facility needs? And there is an element too in this as we look through it. It's in the kind of the commentary that Amanda had is there's a staffing element where hours of operation. So adding more space or building a new building with limited hours doesn't necessarily solve problems as far as demand and providing resources. So there's also that element taken into consideration of, do you have the people, or maybe a first step too is making sure there's enough people to provide the hours to service all of the need that's out there as well. So all of those things kind of have been flushed and worked through internally as the team as we've walked through this and talked with the leadership team about too. So kind of a little backdrop as coming from our last presentation on some of the foundational data to now looking at potential solutions.
So in your outreach, did you guys assess the particular needs of the community? Or that was coming from the district saying, we think we need planning services versus behavioral health, whatever. Did you guys assess that also in your outreach?
Yeah, so both. We've reached out internally to the district employees, to stakeholders outside of the district, and then the community survey as well. So yes, we've reached out.
And we also looked at like how appointments, how full they are, or how far out waiting lists are. That was also a factor.
Well, at this point, for me, it's controlling costs. So, I mean, if you have a serious issue that needs to be addressed, I'm not gonna say I'm not in support of that, but building new buildings and fully remodeling is not something I'm excited to support at all. We don't want to see our costs go up. But we need to try to match the facilities with whatever we're gonna try to provide. And I mean, I can speak for the Payette office, it's very underutilized, so it either makes sense to use it for something or figure out a different purpose for it. And if the other facilities are not functional because they're too small or designed poorly, we're not meeting anybody's need. Yeah, if they're not being used, I'm not sure why we have them. Well, because we can't, because we don't have the facility, so that's the purpose of this is.
In part, and I'll just add to, the board over the years has committed funding to like facility improvements, for example. And as that amount of money has increased and we don't have like a future plan, I don't feel like that's necessarily responsible use of taxpayer dollars to just be growing a bank account without a plan attached to it. So that's part of the reason that I felt like this assessment was important, so that we can think about what are really the needs and anticipated needs moving forward across the district, and how can we best use those dollars for that purpose, if that's the right thing to do, or use them for services. Like, we don't need to be sitting on the money if we don't have a plan. So that was.
Does the district have a reserve account study and a capital improvement plan right now? Will you look at useful life and maintenance?
Yeah.
We have a reserve account that was in Michelle's presentation, the upper left, the LGIP components. But a full life cycle cost analysis, we don't have that rolled out for all the facilities.
We do have, like, all of our facilities are on a maintenance plan, and our facilities person oversees that, so we know, like,
Yes.
what prevention work needs to be done, or anticipated like HVAC upgrades, and some of Clearwater's earlier research has also helped define that for us. And then in terms of like our reserve, you know, Dawn mentioned, we do have that, but then we also have like this board committed fund, which the balance wasn't in front of you today, but I want to say there's probably what, around 700,000 maybe that are committed to infrastructure right now, plus the I don't have the number in front of me, but you guys is committed.
Yeah.
500 something.
Yeah, a lot more, yeah, to it. So, yeah, so we have some funding that's set aside that, especially like for like the ADA stuff, to me. kind of
Those are
rises to
a must do. Those
Yeah.
are not really a elective thing.
Right, yeah. So there's some things that we could prioritize.
Although they've been out of compliance for a long time, so.
I think all of us have. I know our county has an ongoing list that we're trying to work on, so. I like the way that it's laid out in phase 1 and phase 2, where we have the more urgent needs up front and then prioritize those over, you know, expansion.
Yeah.
Although it sounded like from our presentation earlier, the community rooms are a vital need,
Yeah, I would say that's definitely from
classrooms.
our staff perspectives, yeah. Really wanting to be present in the community to be able to offer in-person education, training, classes, and some of those can happen in other places too, but it's nice to have those spaces in our, when we have buildings sitting there underutilized,
Yeah.
it's hard to, but
I like
think
that.
about how we could.
I like that hub approach.
Was there any sort of analysis done, for lack of a better term, a return on investment? Like we go spend all this money in an underutilized building. Is like, did the analysis show or the community surveys show all of a sudden we're gonna get a whole lot higher utilization rate? Or is it, now we're just gonna have a much nicer building that still sits there and doesn't get used?
That's a great question. Something we looked at a lot, and the kind of the variable that makes that a little bit unknown is the limited hours in the satellite offices. And so if we expand hours and the ability to for behavioral health specifically, that service where there was a lot of requested demand. So it's a little bit unknown if you remodel, you have those rooms, and then you have a service provider get out there. Our inclination is that you're going to have the demand and people are going to come use that. But there is a step as far as like the expansion phase. And part of the reason we phased expansion is if you have more resources, you are able to open up those hours, you'll be able to get a better indication before you build more onto it, whether that makes sense or not, to add an expansion. With that being said, too, with the community rooms, that's something there was a lot of feedback to, is being able to use those. So when is the right time to do that? And this plan is all of these scenarios and phases is when we get it all put together, is going to be contemplated over the next 10, 20 years. So not necessarily diving in and investing in all of that right away, but taking care of the high need things first and then working your way into some of those bigger expansions. And so you will have some opportunity over time to, we'll just say, using Emmett as an example, having that expansion there, say that's on the 5-year plan. So over the next 5 years, there'll be additional data and looking at this master facility plan every year and being like, yep, that makes sense. Let's keep doing that. Or we're not getting the feedback that tells us that we should keep going that way because we put in some of the behavioral health options in the other buildings, and we're either seeing lots of use of that or we're not seeing lots of use of that. So you can kind of, so we have, to answer your question, we have looked at it, but there is that a bit of an unknown because of the limited hours. If you just expand that, or all of a sudden you're going to have more people. So, but we do feel that there is interest and there is demand specifically on the behavioral health side, but have an additional facility.
Is it true that none of these satellite plants, I haven't been to Weezer and Emmett, but they're not like they're bursting at the seams and need more space or better design space. They're not being utilized. Would it be better to increase our services and then design the facility to respond to the lack of
That's
efficiency?
a good question that we had talked about is if you are able to expand your services and the personnel to be able to offer that on a full-time basis, so to speak, or more days a week. Starting to do some of that first before, especially the significant expansion, which will kind of give you an indication, okay, now we have service providers there all of the time for, depending on which service it is, WIC or funding, and then that'll give you a good indication of, yeah, we need to expand the space, because it is a little bit tricky to tell with that, but
Staffing constraints.
the stuff.
Offer the
Yeah, I mean,
services at all.
that feels like the bigger constraint.
Yeah. And with that too, something that we talked about in the team is there's definitely an opportunity for community partnership. There's a lot of not-for-profits, there's other government organizations in each of the community and in communities that there's not a lot of presence in. We had some conversation with Homedale School District and just as an example, and that led to, well, interest in partnering and, well, if we could do this and you guys could do this, and kind of planting some seeds. But if there was somebody or the person that was responsible for community partnerships, of being able to go around, facilitate those conversations, and then not just facilitate them, but actually implement them. But you have to have time to do that. Somebody's got to be able to organize. But that's another option with staffing that has a direct relationship to the facilities, because you could open up doors and have maybe an existing facility, like a better use of the library for Homedale. Maybe there's an opportunity for a larger collective effort for that space to be utilized for not just the district, but for the others in the community, or another building there that could be better utilized. But it takes time and somebody to be able to focus and have this conversation. So
They gave us a little bit of a context point as well, that Terry Riley's across the street from the school district, and they had someone who was in urgent need of some mental health support. The soonest they could get in was 4 months. And so there's demand there, especially around the behavioral health. But the service provision and the presence and the ability to provide staff is the consideration.
Exactly, but having a brand new facility is not going to change that.
Right.
correct.
Staff is really the first step.
Yeah, could remember everybody, with this plan is being presented by Clearwater is more of a long-term plan. We need to do the footwork on the front end to get what the citizens want and need and bring that to them. And then if the plans look like we need to increase the size or whatever, we do that in a future date. Right now, what these things are, what Clearwater's showing you is a plan that would be 5, 10, 15 years down the road. So we just, those are the plans that we have to, we're looking at, and like we had them at Hawaii County, and since we've done that, our plans have changed somewhat. So we're going in a little bit different direction. So it's not a plan that you just, this is a revolving, moving plan that can be changed at any point in time. So that's what needs to be very clear on this. It's not something that we're doing today. It's something that'll be done in the next 5, 10, 20 years.
Yeah, I guess I see it, I like seeing how these layout changes could be made, but this could be done if we tried these things and found that we needed, but could easily change too.
And it becomes a really valuable tool in the budgeting process that you mentioned. You come up to the budget and say, this year, we're going to look at Weiser specifically. We've got $800,000 in the budget. This is a good year to go ahead and make those improvements or adjustments. And there's an opportunity to align that with your plan and shift things around, or whichever facility that happens to be.
Supplementally, it also helps with any grant writing, that you have a plan, you have something researched, something tangible that you can point to. So it's also beneficial in that respect as well.
Right.
No, that's a good point. That's one thing we talked about a little bit internally after Clearwater presented to the leadership team, is that that rural health transformation grant funding that's coming to the state. I think like ambulance districts and critical access hospitals should probably be paid that money, but if there's like money that's going to go unspent, like that could help with these facilities, and I think it 2010 too, so there might be other resources we could use and move past potentially. If we felt like these align with the needs of the community.
Yeah, so we presented just a single question survey to the leadership team to ask what in their perspective needed to be prioritized by facility. And so the top facility was Emmett as a priority, then Payette, then Weiser, Nampa, Caldwell, Homedale, Marsing, Council, and New Meadows. But those top three were pretty, it was a pretty unanimous from the independent voting about what those, where the priorities should be focused first.
But that's just in terms of the facilities.
Are there any questions on any of the facilities or maybe feedback or thoughts on alternative paths that you didn't see in there that maybe should be considered?
You know, for Payette, we included that consideration of potential relocation of EMS and the utilization of those 3 front offices. Tried to plug those into that type of consideration level into each of the scenarios that we brought forward.
And Payette, even though it's not a hub building, its location is very much a hub with the schools across and the courthouse and everything. The location is great.
I toured the Weiser one, it's been a month, 6 weeks ago. And one thing we talked about at the time was trying to increase the services. And I think it's kind of a general consensus that if it's available, we should have tried to increase the services first to see what we really need. But on the Weiser one, I think if the volume increases, I would think the renovation would help remarkably there. I'm adamantly against purchasing the next door building because that's one of our attorneys is.
No.
And I think there's some more in the renovation. I was kind of wondering about the back building, the storage building back there. You've got storage inside the building too. If that storage could all be put out there or something. That's just my thoughts on it. But I think we talked, like I said, we talked about my wife and I talked a lot, and I don't know how many people are really aware of the services available in the communities. And there's a lot of people I feel that could use services that don't know about it or don't do it. And I would like to see something increase there.
Yeah. It's one of the things we're prioritizing in our budget this fiscal year.
And that came through in our discussion with Homedale, with the superintendent and their community center, the federal programs director, is they felt that there was not an awareness of service availability or provision in their community, and crossing the bridge to go, that's a real, hindrance for them and Marsing. A lot of them are single automobile families and share, and so not having anywhere else to go, where the Marsing hub is exclusive to those who live in Marsing. Homedale, their community center, offers it to anybody who comes in. And so, resource allocation and availability is a consideration for them as well.
I think that hub as a shared resource probably increases the exposure to district too. Because people are in there for other things too. District campus. Because I feel like in ours, it's just, what happens in that building? I never see anybody going in there.
The hub does numerous things. They do a food bank out of it. There's just a lot of things they do at the hub. We do our chat out of there. We do also chat out of Homedale, but between months. So, but the hub is kind of an ideal thing that was built many years ago for the school, and then they keep part of it for the school, and then the other part of it is open to the for other entities to go in there and utilize. So it's a great building for doing a lot of good things.
As part of this analysis, you didn't look in these communities to see if there was anything comparable to that, right?
In terms of facility
Yeah.
that might accommodate a hub type.
Mhm.
I don't think we looked
We
quite
looked
that.
beyond the facilities.
We brainstormed about like groups to partner with. But at this point, that was the extent.
We did a little bit of research on just the general cost of buying another building. So that was kind of part of it too, being sensitive to that. You had to go buy a building. So that kind of also directed us to stick with updating what you have.
Yeah.
But yeah, we didn't go specifically look for facilities that would work into the community.
And when I was looking at the buildings that you have, I was careful to not change too much, to keep these changes very simple. Like if you look at the demo plan, it's mostly just removing doors and adding a few walls. In Emmett, I mean, it's really dividing the reception, and you can use these two spaces as is, or dividing the conference room. So they're small changes, not major renovations.
In the Caldwell main office, what is the big entities there? Just moving walls or making different hub cubbies or what?
Reducing the size of the workstations, say in environmental health, as more inspectors are needed, because they are larger than what's recommended. So you could probably close to double the number of inspectors here. There's some space in the Fepper area that could be improved. And there's some extra space in the administration. So things can shuffle over time. Right now, it meets the staffing needs. But there's room to grow within this building.
Okay. So the priorities are basically the three outside.
Yes, and
with,
even
Emmett,
Payette,
Washington, and Payette.
yeah, Payette's still in good shape. I mean, some of it could be like the storage room in the back. That stuff could be moved and it becomes a behavioral health room without having to divide any rooms or move other things. I mean, there are some shuffling that could just naturally occur right now in Payette. But these changes could help it long-term. They're options, but honestly, just, relocating some storage to make some behavioral health rooms would go a long way.
And maybe the one more time-sensitive item at the Caldwell location is that infectious disease room.
Yes.
Which would just be adding an exterior door and some ventilation. But yeah, the other items would be longer term options.
Well, I've been to the Washington one years ago. I went and looked at it, and it had numerous issues. One, the layout's terrible. Two, parking's not the greatest in the world. Three, there was absolutely no ADA compliance. So there was quite a few issues there. But I don't know financially where we go with that one. And it doesn't see the amount of patients that we need to have to make it even a viable place. So those are all things that we need to look at.
But is it not seeing the patients because of a lack of staffing or because of the facility?
I'm not sure, but I'm because I went and looked at it a long time ago, and probably it was a little both, because it's a little bit closer to the downtown residential area than anywhere else. There was talk of moving it, but back then, this is about 8-9 years ago, there was talk about moving it then, and but you were taking it away from the residential area where at least foot traffic could get there. Where if you move it way out, they were talking about up further out by the Rileys, that was going to create a issue with those that don't have transportation would have a problem getting there. So there was a lot of things to look at.
I have a question. So if we were thinking at like Emmett, for example, we've said that ADA is priority to make some of those changes. But one of the biggest ADA issues there is that humongous 6-foot tall counter.
Yeah.
And is there a way to fix the ADA and have it prepped so we don't have to like redo it again if we then in the future make other changes?
Yes. So with that reception, I wish I had a picture here, but it is kind of a tall wall that could be taken down to the height of the workstation. And actually, to make it ADA, some of that can still stay high. You just need a transaction area that's down at 30 inches, which would be the height of the table. And they need knee space to be able to pull in underneath. So it could be something that is taken care of maybe on this edge up here, or that whole wall comes down and everything is lowered.
I was just thinking of
Yeah.
work duplication. If we do an ADA fix and then decide, hey, we're gonna go forward with these other changes, and now our ADA fix doesn't fit the changes. Like, I'm assuming there's ways to like, okay, we fixed it. Now we won't even have to worry about it when we do make other changes.
Yeah. In this case, it's something you would need to do anyway. And, just looking at these proposed changes, it wouldn't be like you're putting yourself in a spot where you're stuck. It can just remain, especially since if there's an addition for the community room. Unless, something like this became all community room, then you're demolishing the reception after doing all that work. Is that what you mean?
Yeah.
Yeah.
And that's probably true in all of them.
Yeah, actually, all of them are high. Yeah.
And it's a great question, because looking at that, and it's kind of why you're not necessarily deciding exactly what the long-term remodel is, but having a decent idea of that allows you to, like, if this gets parsed with ADA compliance, let's get that taken care of first. But to not duplicate things, sometimes there may be situations where you just have to, like at the Emmett ramp,
It's
not If you- showing get that in ADA compliance, and then you did end up expanding 10 years from now, it would get moved, so there would be some duplication, but limiting that. So you don't do something now and then have to tear it up and do something again in 3 or 4 years, so that you kind of have that current vision of what the need is right now and that long-term vision, and so you're efficient in your decisions of what you do.
You seem to see that a lot in the roads.
Okay.
I'm gonna put a road in, no, I'm gonna tear it
Yeah.
right through it and then repave it. Right.
Okay. So does anybody else have any more questions on this? And for us, for you guys, are you done, or is there?
No, I think that's what we had to present, and just get your feedback. If there's additional questions or information that you would like to see, things that maybe we hadn't considered that you'd like us to bring back. Or if the way things are laid out with multiple phases over the different buildings, with that priority of phase 1 being that ADA compliance piece. Any tweaks that we need to make as we bring this back and refine. And then I believe cost scenarios come next. But if there's takeaways for us, we'd be happy to take that on.
And largely, we just wanted to make sure we're on the right path. So next steps would be a draft of the report that would further define these scenarios, timelines, and kind of prioritize what that is, and then come back and you can help adjust that to what what you think makes the most sense, and then ultimately get to a final.
Is there any way that for them to do that, that we could provide them with scenarios like, and maybe this was in your analysis, was our vision for Weezer is to have 2 full-time behavioral health providers, or just kind of in imagining what we would like to be providing, say in 5 or 10 years, and then have them respond to that with how to meet that. Which maybe you've done that, maybe that was part of it.
Well, I mean, I feel like as a public entity, we're here to serve the public, and so trying to get that public input to help us to inform our decisions, right? In terms of what the community feels it's the most important need, and through like their work and like, you know, Beth's done a lot of work talking to like clinic providers, for example, in the community to see like, you know, do they see us as competition, which we know we don't want to be? Do they see us as complementary? So that we're kind of best utilizing our resources. The short term, I think, is fairly easy to see. Like, we know behavioral health is a need across our entire district. I can say like, yeah, let's do that in the next 5 years. Like 15 years from now,
Yeah,
I think it's
we don't-
harder to see, right?
We don't know,
Yeah.
but we have to plan, I mean, to me, we need to fill the spaces we have
Yeah.
to know what kind of physical changes they're gonna need.
And I think, so I guess I'd say on the clinic side too, because we've been through a period where we haven't had consistent, regular providers in our satellite offices, it's hard to know at this point, like what the community would utilize. You know, like we could put a provider there, but like to what's already been kind of shared, we know there's provider shortages.
But the community needs assessment.
Yes, it does.
Evaluates that too.
Yeah.
I mean, what he said was the first I've heard of that. Is that there's a real need for clinic services. I can't tell in our community. I don't hear it. I don't sense that there's a shortage, but
Yeah,
communities are different, so.
they are. And our community health needs assessment that just got completed could help us delve in a little bit more specifically into certain communities. It's not even officially published yet, but we've the opportunity to see the version. So I think that could help. And then, like I said, I feel like there's just kind of a continuing need and appreciation for us to be able to host like the Fall Proof,
Right.
food handlers training, naloxone training, mental health first aid, all those kind of like in-person meetings. None of our satellite facilities can accommodate that. So I think that's a good investment long-term if we could work towards remodeling some of those spaces to be able to achieve both, really, because we would continue to have clinic spaces in all of those areas. And then I think even longer term, thinking about just the growth, I have like, it seems like Homedale and Payette are going to be like the next kind of pushes for us in terms of like population growth. So thinking about like the facilities, I don't think we want to go backwards, and the Payette facility is a good size. I think it could serve us for a long time at that size. We don't have anything in Homedale, so maybe something like a hub would be important to consider in the future.
Well, I think that's where we get with the city and talk, about other areas of the school that maybe we can come up with something that we coexist with other entities. And but we have to be the ability to have privacy also. So it's just things we can look at.
I have had the chance to read most of the new needs assessment. It does not give a real clear vision on what access to care fully means. So the implication is more primary care, but then that also has, there's a variance there of what that means. So are we talking like I need to go in for my woman's health or just my physical wellness exam kind of stuff versus, hey, I sprained my ankle and I'm gonna go see my primary care doctor. It's not clear where that is. And I think that's also we talk about provider needs and what we need, there's a difference there. Like, we're not someone you would come see because you necessarily like sprained your ankle, but we could be for wellness checks and vaccines and women's health things. But across the board, there's probably not enough of any of it. And so trying to differentiate where our niche is to help not appropriate services, the needs assessment doesn't really get into that too much, but I think it's across the board and worse in some areas than other areas, has been my experience, because I've worked out in Payette, Weezer area for years and saw the primary health or care stuff was really, it was hit or miss. So it's, the clarity is not as good as we would like it to be, I think, so it makes it harder to.
And I would also say we can be creative as well. Like District 6, they have a county that had no pediatrician, and the district hired a pediatrician to work out, to like spend time out in that county to expand access. So they're not like, and in terms of like hiring, I don't think they're necessarily on staff. I think they're like a contractor. So I think there's ways to maybe get at some of the unique gaps that might exist. It doesn't necessarily mean that we are like managing all of this. That makes sense too. Other things to think about as we try to collect information and make good decisions about how we move forward.
Okay. Anybody else have anything, any other questions or comments or input for these guys? No? Kelly, Dr. Tribble?
No, I'm good.
Yeah, I'm good. Thank you, guys.
Thank you for having us. If you do think of something, please feel free to reach out if something comes up and you'd like to share it with us. Our next step, like Jay said, is to start putting this into a report and lining that out, and then bringing that back to you for refinement and consideration.
Thank you. Thank you. Okay, we will move on.
Yeah. I will go fast as I can because I don't. So the first one's just informational in your packet is just the normal report of the summary of grants, contracts, and sub-grants that we've signed off on, just the cover sheets for that, so I won't go over that, but if questions, let me know. Also, moving on at our last board meeting, so that would have been November, Rick had presented on oral health program, and there were some questions around how much work Delta Dental does as opposed to us. Beth already talked about that today, but in your left-hand packet or board folder there.
To see that to you.
Oh, never mind.
I'm happy to scan and share it.
Okay,
In their folders.
I can just go down,
Yeah.
I can go down the list. You
Sorry about
you
that.
did it earlier.
Yeah.
So Delta Dental provided 2,748 services in King County. This is for calendar year 25, looks like. Hawaii County 85, Adams 118, Fayette 96, and Washington 0. And just as a reminder from what Beth said earlier today, we work together and complement each other on where we spend our time. So like in Adams County, we don't go there. Delta Dental has that covered. In Washington County, Delta Dental doesn't go, and we have that covered. So, and then we kind of share King County
And just because I hadn't thought of this before, does Delta Dental, do they do it just as a community service or because it helps them because their insured population has fewer payouts? Do you think it's to their benefit to do it financially?
I would guess it's more of a community. Because most of the kids they're going to see are on Medicaid.
They're not their population anyway.
Probably, well, that, and there's just not a lot of access for youth or children for dental access in general. So I think they might see it also as an investment in terms of like early prevention to mitigate like the higher cost of healthcare for youth that they
Great.
have.
I guess that's what I'm saying, but is that a financial, is it in their financial?
Probably tax wise, it is.
Yes to both, probably.
I would guess. I doubt they're just doing it out of the goodness of their hearts.
Can't say.
Okay.
Okay, legislative updates, not much has happened, in terms of bills being put forward yet. But I am working, as you know, with Commissioner Brooks, and IAC on trying to get the food fees removed from statutes, so we're actively working on that. And then, Russ is kind of taking the lead to work on getting the clarification between Idaho Code 393801, which gives our authority to to screen and treat for sexually transmitted diseases, to get clarification between that statute and the newer statute 32 and 15, which is the parental consent law. So we have two statutes that don't align. And so we're trying to get clarification on that, on what the legislature's intent is. So that's the update on that. Idaho Association of Counties Public Health Working Group met for the first time at the beginning of January. The next meeting is in March. And right now, James and I are the public health district directors that are on that work group. James is from Eastern Idaho. And he and I are going to be working on collecting some data and information gathering around the county contributions to the health districts over the last 5 years and some other data that the work group asked for. As a reminder, Commissioner Brooks and Commissioner Reeve are on that work group as well. So I don't know if you have anything you want to add in that conversation.
Mostly just venting, I think.
Venting and level setting maybe on what we're going to do.
I think it would be really interesting to go back and look at our allotments that our counties are paying based strictly on population. Have you done that?
Yeah, like if
so
we
just,
we took out the
Yeah.
property valuation side.
I wonder how different that would be.
I know a guy who likes numbers and spreadsheets.
I do like numbers.
I mean, I've crossed my mind that I should go look at it myself just based on those numbers, but I haven't done it.
Well, we have to pull together the data for each group anyways, and we could easily create a separate spreadsheet that decides the population so you guys can see it.
And I think those numbers retro are available, so I think we could roll that back quite a ways. There may be some gaps with it, but we can take a look at it for sure.
So we'll keep you updated on that. And then the last item I had on here is our legal counsel, Mike Kane, who many of you know, notified me a week or so ago that he's planning to retire in October. He's been our legal counsel and Central's legal counsel for over 20 years. So that'll be a huge knowledge loss for us. And I haven't had a chance really to talk to Russ since he let us know. Russ is the director in District 4. But I think it's been really beneficial for us to have shared legal counsel. So what I would like to do is see if he's agreeable to us working with Mike to see if there's a few people that he might recommend. And then having them maybe meet with the board somehow, obviously involve the board in whatever decision we decide moving forward on who will represent us. But we have a little bit of a runway he gave us. Fortunately, if we last that long.
So when did he say is it?
October, but he also gave me a caveat that we'll see, but October is what he's thinking. So I'll keep you updated on that too. If we decide to move forward with making that selection. So that's all I have for directors this morning.
So the future agenda items, are we looking for suggestions, or are you going to tell us what you have in mind?
That's usually just there for if the board has anything they want us to add. Otherwise, we'll just follow the work plan that the board approved last October maybe.
Okay. Does anybody have any requests for agenda items? Kelly, Dr. Tribble? So no.
If there is any, just, let, Nikki know sometime in the future, so when we meet, for the new agenda, we can work it out.
Okay.
So if there's any new ones coming out, that anybody thinks about, just get a hold of Nikki and let her know.
Okay.
Yeah, we do have, we were supposed to have a vaping presentation in December that we then moved to January, that because of today's length of meeting, we moved. So we do need to fit that in, and then we wanted to add the Washington County.
Yeah.
Topic.
I don't know if you're here, I got confirmation that both Wendy and Ashley can join the March 24th board meeting. So
Good.
it'll be March 24th, Dr. Tribble too.
So those aren't on the work plan.
Okay, thanks.
So we don't need a motion to adjourn, right? We're adjourned.
Yeah.